I will tell you that that was one of the really important considerations that I took into account with, we took into account with the order that I gave out earlier last week. And we've been working with all of the unions, with the Health Employers Association of BC, with my office, to ensure that we can put in place a rational and reasonable ability for people across the sector in long-term care to work only at one facility. And as we've talked about before, part of the issues were subcontracting out and private contractors who had people working at multiple places. So right now, for the pandemic, we are taking a really important initiative across the province to ensure that people are able to work only at one facility, and that that is supported across the board, and that we get rid of some of those issues that have been plaguing that sector. But I'll leave the details to you.
Okay. To say, absolutely, the work that we're doing in long-term care, the work of medical health officers in all of our health authorities, the work of unions in long-term care, the work that we're doing with BC care providers and denominational health, all points in that direction. We have to continue to do the work we're doing to make to give value to the work of all of the workers in long-term care. So I agree with that there are lessons to be learned and lessons that are going to be learned. And this is some of the work that we've been doing in the last number of years with employers and with unions alike. And I think, for example, the work we did to get rid of Bill 2994 is part of that, but it's work that we have to all do together to make sure that our workers are safe, that the work is not precarious, and that that it's valued as it should be in our society. I think that we didn't need this pandemic to know that the work done by workers in long-term care is some of the most valuable work done by anybody in BC. I believe that with passion. I think people in the system believe that with passion, and we're going to continue to do that work. The important thing now is that we follow the orders of the provincial health officer, that we follow the orders of medical health officers, and we support the workers in long-term care, because I can't imagine more important work in society. It's something that we've worked on together for a long time, and we're going to have to continue to do more work on. Another example of that, of course, is home care and home support, and the work we've done to bring that work, in that case, under health authorities. The long-term care sector is a little different than that, but we're going to work together with all our partners to ensure that workers are safe, that the quality of care is high. That's the work we've been doing together for a couple of years, and it's the work, and if anything we've learned from this pandemic, it's that we have to continue to do that work together in the coming days and weeks and months and years.